Hey guys, welcome back to my channel. If you are new here, please do subscribe so that you'll get notified every time I upload a brand new video. So let's begin. Here in this video, we are going to study upper respiratory tract infections, and the most common respiratory tract infections include acute otitis media, acute and chronic bacterial sinusitis, and acute pharyngitis. So from this diagram, we can see it is sinusitis, which is the inflammation or the infection of the sinuses. Next is pharyngitis, which is the inflammation or the infection of throat. So basically we call it as sore throat. And also we have ear infection, which is middle ear infection, that is otitis media. So these are the most common upper respiratory tract infections we see in day-to-day life. Let's begin through introduction. So, upper respiratory tract infections are contagious infections of the upper respiratory tract, which include nose, throat, pharynx and larynx. As through the diagram we studied, the nose, throat, pharynx and larynx are basically involved in the infection. What are the most common URTIs, that is upper respiratory tract infections? And those include otitis media, sinusitis, pharyngitis, and the less common or the least common we see is laryngitis, rhinitis and epiglottis. So what are the etiologic agents? How do these URTIs cause? So the most common etiologic agents include Streptococcus pneumoniae, which basically causes acute otitis media, which is the inflammation of the middle ear, and also acute sinusitis, that is inflammation of the sinuses. The next is group A, hemolytic streptococcus, which can cause acute pharyngitis, also called as sore throat. And also Staphylococcus aureus is also the most common etiologic agent we see nowadays. So now we'll begin with the acute otitis media. How it is defined? How acute otitis media is defined? So it is defined as an inflammatory condition of the middle ear, which results from the dysfunctioning of the eustachian tube, and the inflammatory response in these conditions lead to the development of exudates within the middle ear. So basically what happens in the acute otitis media is, so there will be some dysfunctioning of the eustachian tube, and also there is some inflammatory response. So this inflammatory response may lead to the development of exudates, which is filled with the exudate is filled with the blood or any of the inflammatory mediators like cytokines, etc. within the middle ear itself. Infection can occur if bacteria or viruses from the nasopharynx region. So infection can occur, infection come into picture when the bacteria or the virus from the nasopharynx region contaminate this fluid, that is the exudate. So what happens then? It will produce an acute or chronic illness. So there are three types of otitis media basically, and those include otitis media, that is acute otitis media, otitis media with effusion, and also chronic otitis. So these are the three types of otitis media, and these are differentiated. So basically how to differentiate these three types of otitis media? So they are differentiated by the onset of the disease, the signs and symptoms of the infection, and also the presence of fluid in the middle ear. So by these three factors, the three types of otitis media are differentiated. So as you can see here, in case of normal middle ear, so when the person is not infected with any of the virus or bacteria, so the eardrum is normal now in case of normal patient, and the eustachian tube is in the normal situation. Whereas in case of otitis media, what happens to the middle ear is there will be buildup of the exudate, that is of the blood or of any of the inflammatory mediators, which can cause severe pain and also some kind of drainage through the middle ear, as you can see from this diagram. So let's study the etiology and also pathophysiology of this otitis media. So approximately 40 to 50% of otitis media are caused by viral pathogens, and some common bacterial pathogens include Streptococcus pneumoniae, Haemophilus influenzae, Moraxella catarrhalis, and also methicillin resistant Staph aureus. So these are the most common pathogens which are involved in the otitis media. So this acute otitis media, how the pathophysiology will be. So how exactly the otitis media is caused and how the body will respond to this otitis media, let's study now. So basically otitis media or the acute otitis media follows a viral upper respiratory tract infection that cause eustachian tube dysfunction. So basically this otitis media is caused by the viral respiratory tract infection. So basically it follows a viral respiratory tract infection which causes dysfunctioning of the eustachian tube and also mucosal swelling. As we saw in this picture, there was a mucosal swelling in the middle ear and also there was some dysfunctioning of the eustachian tube. So a non-infected ear has a thin clear tympanic membrane. So basically when we see through the non-infected ear, a normal ear, so the tympanic membrane will be thin and clear. In case of otitis media, what happens is this middle ear becomes clogged, means blocked with some fluid bulging and erythematous tympanic membrane. So what happens is in case of otitis media, the middle ear becomes clogged with the fluid, some exudates or any kind of fluid with the inflammatory mediators, which causes bulging and also erythematous tympanous membrane. So the bacteria or the any kind of pathogen, when they colonize the nasopharynx and when they enter the middle ear, so bacteria any kind of pathogen, when they colonize in the or when they grow in the nasopharynx region, they obviously enter into the middle ear and are not cleared properly, and if these pathogens are not cleared properly by the mucociliary system which we have in our body, then what happens is bacteria start to proliferate, bacteria develops or it grows and it causes an infection. So how these acute otitis media manifest as? So what are the signs and symptoms a person can feel or a person can show? The first and the foremost is severe otalgia will be there, that is ear pain in case of more than 75% of patients. Obviously the patient may come with the otalgia, he'll be having severe ear pain, and also in case of less than 25% of patients, fever will be there. So when we examine the patient having the ear pain or the fever, so the eardrum will be discolored, thickened and bulging. So we can see the eardrum, it will be discolored, it will be like grayish in color and also it will be thickened and bulging. So we have the most common diagnostic test include pneumatic otoscopy. Doctor will have otoscopic test and he'll perform otoscopic test or tympanometric test in case of patients who are suffering from severe ear pain. And the doctor might also ask some lab tests which include gram stain and culture and sensitivities of the draining fluid. So we'll collect the fluid which will be draining through the middle ear, that will have to culture and that is cultured basically. And if the tympanocentesis is performed, so basically we have to we have to collect the draining fluid and we have to determine what is the pathogen which is causing the middle ear infection or inflammation. So how do you basically approach to patient? if a patient has come to the doctor having severe ear pain, how do you approach him? How do the doctor approach basically? So first and the foremost thing the doctor has to do is he has to differentiate the acute otitis media from otitis media with effusion or chronic otitis media. And then he has to address pain with some oral painkillers or analgesics like ibuprofen, acetaminophen, etc. And then he has to consider if a brief observation period is warranted, or if the disease severity or patient characteristics require immediate antibiotic therapy. So basically the doctor has to decide, he first has to check the patient, and then he has to decide if the patient requires immediate antibiotic therapy or no. So what are the non-pharmacologic therapy? How can we treat a patient without using the actual therapy? So the OTC, the over-the-counter drugs, over-the-counter drug is acetaminophen, or NSAIDs like ibuprofen can be used to relieve pain in case of acute otitis media. So in case of children, or in case of patients who are 3 to 18 years of old, then along with this acetaminophen, we can give ear drops with local anesthetics such as amitocaine, benzocaine or lidocaine. So this will provide some pain relief, and also the oral medication is given to a group of patients who are 3 to 18 years of old. And because of less and increased side effects, neither decongestants nor antihistamine should be routinely administered. So basically, in case of otitis media, decongestants and antihistamines should not be used because they'll have increased side effects and decreased therapeutic activity. So let's study pharmacologic therapy now. So antibiotics can be used, but antibiotics may have some adverse drug reactions and also increased antibiotic selective pressure. So there are so many antibiotics nowadays, so the doctor has to decide which antibiotic is to be given. So that will be a major problem, major antibiotic selective pressure it's called. Then we find something called delayed therapy here. So basically, delayed therapy is done, which means a healthcare worker provides a patient with a treatment but encourages the patient to wait to use the medication for at least 48 to 72 hours to see if the symptoms will resolve on their own. So this is delayed therapy. So who are eligible for this delayed therapy? Who are the candidates? So children who are 6 months to 2 years of age without severe symptoms and also uncertain diagnosis. So these candidates are suitable for delayed therapy. Then the next category is children who are 2 years and older without severe symptoms. They can opt for delayed therapy. And also children who are 2 years and older with uncertain diagnosis, they can go for delayed therapy. They can wait for 48 to 72 hours to see if the symptoms will resolve on their own. So if the symptoms do not resolve on their own, then the patient has to take the antibiotics. So if antibiotics is the option, then the primary drug is, or the drug of choice is amoxicillin, which is 80 to 90 mg per kg per day. Okay, so this is the drug of choice in case of middle ear infection or inflammation. And if pathogens or the bacteria or the virus that produce beta-lactamase, then what we have to do? We have to give amoxicillin, that is 90 mg per kg per day. Along with the amoxicillin, we can give beta-lactamase inhibitor, that is clavulanate. Amoxiclav is the drug, so that is given So the dose of clavulanate is 6.4 mg per kg per day. So what are the treatment plans for the patients with moderate to severe illness? That is the temperature which is more than 39 degrees, and also he has severe otalgia, that is ear pain. For them, the same option, amoxicillin and clavulanate, is given with the same dose, that is 90 mg as well as 6.4 mg. Then if the patient is suffering from severe otalgia and also he is unresponsive to any of the above medications, then intramuscular ceftriaxone is given. Cephalosporin class is also used, and it is reserved for those who have severe and unresponsive to drugs, above drugs. And what about patients who have penicillin allergy? Then those patients are treated with the cephalosporin drugs, that is cefdinir, cefpodoxime or cefuroxime. And the surgical treatment is opted, or it is used in case of recurrent otitis media. So this recurrent otitis media is nothing but, it is defined as at least 3 episodes of the symptoms appearing in 6 months, or at least 4 episodes in 12 months. So it is recurrent otitis media, and the patients who are suffering from recurrent otitis media are undergone surgical insertion of tympanostomy tubes. So they are called T-tubes, which is an effective method for prevention of recurrent otitis media. They are basically small tubes that are placed through the inferior portion of the tympanic membrane under the general anesthesia and aerate the middle ear. So the aeration is nothing but we will drain all the fluid or the exudate which is present in the middle ear. So this is the last option, basically the surgical treatment for patients who are suffering from recurrent otitis media. So that's it for the video. Thank you so much for watching, and if you like this video, please do like, share and subscribe. Thank you.